Going live. Well, hello, everybody. We're live. We're just going to wait 4 minutes for 5 o'clock just to make sure that those people wanting to come on live are ready to come on live. So this is Lynn from A Different Kind of Better Clinic. Also the person who set up A Different Kind of Better Facebook page. And with me is Doc Tom, who you're going to be meeting shortly. So I'm just going to mute out for about 4 minutes and we'll be right back. Thanks for joining us today. We'll be starting in 2 minutes. Be right with you. Okay, well, hello, folks. So for those of you joining us today for the first time, my name is Lynn Weems. I'm a certified preventative healthcare practitioner. I'm coming to you live from A Different Kind of Better Facebook clinic. And today our special guest is Dr. Tom, and I am so pleased to be able to introduce him to you today. First of all, I do want you to understand that A Different Kind of Better is a new platform. It's being designed for wellness practitioners to come online and globally teach people about all the different modalities and different ways that we can help people feel a lot better and get a better quality of life. So that was me a lot of years ago, and I'm hoping that we have a lot of people joining us today that, you know, maybe are looking for that one thing that is going to help them, that maybe they've been looking for many, many years for something that is actually going to do the job that they need. But today we're going to be focusing on head, neck, jaw, and shoulder discomfort and TMJ joints. And we're going to be looking at things that could be causing this that maybe, or perhaps you didn't realize was even probably causing this. So we have the expert. Dr. Tom has been around for about 40 years and is still very active in his medical practice. He is a very special person and comes with some really, really advanced skills. I don't know a better way to say it than that. He goes above and beyond, let me tell you that. And I'm going to turn it over to him today. Normally I ask questions and I participate, but today, because he's so valuable and I want you to be able to get as much as possible in this next 28 minutes or so that we have him here. If you have any questions at the end, please make sure that you message us. We promise that we will get them out to you. Dr. Tom is our consultant physician for a different kind of better clinic, and we rely on him sometimes to help us in areas that a natural healthcare practitioner doesn't have that skill in. So we are a great team, I guess. We work together very well and have known each other a long time. So without any further ado, let me introduce you to Dr. Tom. I'm going to give you the chairman's chair.
There you go. Thank you.
You're so welcome.
Oh, it's really good to be able to sit down. Hi. And it's good to be able to share some of what we've learned in the last 40 years in practice. And what I would start off with is sort of making a picture of a circle. And let's just simply, that's a bad circle, but let's say it's a pie. And we just take a tiny slice out of that pie and we label that as everything that we know. And then we look at the pie and we take another little tiny slice out of that pie. And that's everything that we don't know. But we know that we don't know it. For example, if you're on an airplane and the stewardess comes and says, both pilots are ill, anybody know how to fly this plane? You're for sure, you're not going to put your hand up. Okay. You're just going to put your belt on or your whatever parachute. So now we've got this pie with two tiny little slivers. And what's the rest of the pie? The rest of the pie is stuff we don't even know that we don't know. So there's stuff we know, there's stuff that we don't know, but we know it. And the rest is what I'm going to tell you today. Sort of. We're going to do an anatomy lesson as well. So there's some complex things going on here. I'll blot myself out and we can actually see the mirror image. We can actually see the wing bone at the back called the scapula. We can see that there's a lot of structures, a lot of muscles. And we're going to give a full anatomy lesson, but it's going to be over in about 30 seconds. This is an ugly dude that we ran into. And once again, we can see the collarbone here, or we can see the collarbone over on the other side. But we see there are muscles that go up towards the ear that we're going to tell a bit about, but you have muscles, a group of muscles that we have to talk about relative to head, neck, and shoulder pain. Many people are struggling with pain that they've had for years and years and years, and they've gone to numerous practitioners that say, well, we've done the x-rays, we've done the MRIs, we don't see anything going on here. They may have gone to a dentist, and the dentist may say, we need to put a splint in your mouth, and that's a couple of $1,000, and that may be beneficial or not. Multiple practitioners take a whack at you to see if they can get your mobility up, to see if they can reduce the pain. The pain is in the head, but it's also in the jaw. It's also in the neck at the front and in the back. And it's also often into the shoulder. And it comes from a variety of reasons. One of the things that we've done in the office is look at Janet Travell's myofascial work. And she was a personal physician of John F. Kennedy and worked with his chronic low back pain and his severe headaches. And so she's written several manuals, which are called myofascial techniques, where essentially you look at a muscle, you look at the belly of a muscle, and there's a spindle cell. You can look spindle cell up. It's a mechanism within the belly of the muscle. And at the end of the muscle where the tendons are, because muscles are attached to bone at each, or fascia at each end, but at the end is something called the Golgi tendon reflex unit. And those units get reset with injuries. When we look at history, there's a large number of people that have had not a turnip bang into their head. Maybe their spouse has hit them with an elbow by accident. They've fallen out of a chair. They've had a car accident, and maybe the seat belts bothered their upper mechanisms. They may have had the airbag blow up in their face, or they've been in soccer or basketball or in hockey or football, or just fooling around at home and somebody's just banged into the head. When you look at a history, listen to their story, they kind of forget that they fell out of their crib when they were 6 months old. When they forget that their brother or their sister whacked them with a toy really hard on the side of the head or the back of the head, or they fell out of the high chair right back on the back of their head. Those injuries add up, and they sometimes they set the jaw in a certain way, so we constantly bite down. Other times, most head injuries, severe head injuries with car accidents or sports, go undiagnosed, and people find that their thinking isn't clear. They find their emotions are all over the place. Their fatigue mounts, and their life is sort of in shambles. So we need to look at common things such as a head injury. But let's take my friend here. This little friend that I have here is called Turtle. Okay, and he's really happy. And what I want to do is tell you what most of us do, and I'm using the term turtle because if I pinch Turtle, he's gonna become like a turtle and push his head way down. He's gonna make his neck like that. That's if I hurt him and there's pain. If I threaten to punch him in the stomach, he's gonna bite down with his jaw and do the turtle thing again. If he's really, really weak and he has to lift the refrigerator, he's hungry. If he has to lift the refrigerator, he will bite down with his jaw, and he'll also lower his head down in order to recruit muscles. And the other thing is, fatigue is a big thing, and many people who work at a desk have their head too far forward and their neck cranked around. They don't have support underneath their feet, and so they strain their back and they strain their neck. So pain will do it, fatigue will do it. And by the way, I just punched him in the nose, and anger will do it too. So if we hold a lot of emotion, then we bite down. And often we just reset the mechanism in the jaw. So what I wanted to do is put him back to sleep here. And I want to talk with you a little bit about Mitzi here, because Mitzi is an acupuncture doll. And I'm just showing that maybe some of you have never seen acupuncture pathways, how they are, but they run along the back. They also run into the jaw and into the face. And the interesting thing is the acupuncture spot that commonly women have, and now men have as well, is they have their ears pierced, okay, all over. But the bottom in the lobe, when you pierce that, that's the acupuncture pathway spot for the TMJ, for the jaw biting down mechanism. So sometimes you need to get that ring out of there or that stud out of there. Sometimes it has to be gold or it has to be a neutral metal. But people just are not aware of that. There's over 700 acupuncture spots in the ear itself, and the body has lots of acupuncture spots. What I want to show you is, or give you a summary in terms of where we're going to go. We're going to go with the head, we're going to go with the shoulder, and we're going to go with the neck. And we're going to tie the pains in those areas together in ways that you perhaps haven't had a chance to understand. This is a nice little drawing of this. These are compliments of Janet Travell. This is a huge muscle. It's called the temporalis. It's over the temple bone, and you can see on the one side the actual muscle, but you can see the marked areas where you get pain referred to. And sometimes people say, well, that must be my migraine, and often it's not a migraine, even though you take migraine medication. When you're a trapeze artist, you go ahead and you put into your mouth a mouthpiece and you grip down deeply on that, and then you suspend 3 people on that rope 100 feet off the ground. So you're able to put a lot of force using this muscle called the masseter. And when you put force from biting down a lot, then you get sinus-like pain, or you'll get pain in the teeth. Sometimes you get pain into your ear. And most doctors are not aware that maybe they should look at these as possible factors for headache or for pain. These are sweet ones because these are muscles on the side where my fingers are clicking. This is called the scalenii. There's 3 muscles, and they attach underneath the collarbone or the clavicle. They attach onto the first and second rib. But there's a baroreceptor, which is a blood pressure receptor just under those muscles. When they go into spasm, they can change your blood pressure. But when they go into spasm, they commonly will give you symptoms into your arm, into your shoulder, down into your hand. And you think, well, I've got carpal tunnel syndrome, or I've got a shoulder problem as well. So in the muscle itself, you can see trigger points. The trigger points are points where the muscle has gone into spasm, where it's been injured in a certain way. And we'll just show one last one. And this is a muscle that starts way, way down at the back, way down close to the pelvis. And it's called the latissimus dorsi. Well, it comes up, it attaches to the spine, comes up underneath the armpit, and will commonly give you a lot of pain in between your shoulder blades, but just at the bottom of your scapula, the wing bone. And people say, well, can you just work on that muscle and just work on that pain? And you need to be able to understand. So that's part of the anatomy that I can share with you. We have a group of people now who are actually therapists that are listening, and they know some of this stuff or most of it. And I'm going to suggest that they look at Janet Travell's trigger point manual so that they can have an understanding, even if they're a massage therapist. After you've done 10 massage therapies and the pain is still going on, then you try something different. Okay, so I'm just looking at the communication that takes place when the jaw bites down. There's Penfield's homunculus, which is a doctor in McGill University, drew a picture of the brain and superimposed a picture of a doll or a small figure, human figure on that, and found out that huge amounts of information for the nervous system were related to the thumb, because we are special because we can oppose, we can grab our thumb and use things that way. But the other one that has huge amounts of innervation is in fact the jaw. So on that small picture of the body, there's a huge jaw and a huge thumb, and the body's only this long. So when we start messing with the jaw, we can start messing with a whole lot of systems. From when we looked at the little doll with the acupuncture, we know that the acupuncture system goes into the jaw area, but the acupuncture system relates to the stomach. So if you're doing a lot of biting down, it's very possible you'll be having stomach issues. If you're having lots of stomach issues, it will make you bite down. Most of us, depending on diet, will have bloated tummies, and the small intestine acupuncture pathway comes into that area as well. So if you're doing lots of TMJ, you may well find that you've got lots of troubles with small intestine. Thyroid is also there. And then the muscles that come across the neck, specifically, especially with this, they actually come across the neck, and the acupuncture pathway that begins on the hand, it comes up through the elbow, comes up through the shoulder, actually crosses these muscles and ends in the nose. And so if that pathway is not working very well, somebody will have chronic stuffy nose, and they'll have a sore shoulder, and they'll get into biting down with the TMJ. So the acupuncture system, although I'm trained to do the needles and you have used laser beams, I use the concept of acupuncture in terms of what's going on. There's a system of 12 acupuncture pathways. Half of them begin or end on the feet, half begin or end on the hands. With people with TMJ, they often can't um, they can't walk quietly across a room. And they often have their head in one direction. They often have their hands stuck up holding their head because the neck muscles are tired and fatigued. And so if you're one of these thump 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 persons, you're transmitting all kinds of what we call proprioception in through from your feet up your spine and up into your neck. But as well, your neck is ready to fall off, so you do the turtle thing as well. So you have to, Traeger is one method of walking very softly, and it's a matter of placing your foot very, very quietly. So some people can look at Traeger. I'm just looking at the time here. Oh my gosh. Okay. So head injuries, and we're looking at shoulder injuries and gut and neck. So go ahead.
Sorry. Is there something they can do at home to help release some of those? So for example, trigger points.
Well, what they can do is they can find that very tender spot on that muscle, which is the masseter muscle, and the rheostat, which is how you turn a light up or turn the light down. The rheostat is actually at the very bottom of the breastbone. It's a more prominent bump there with men as opposed to women, and you simply find it by following the ribs, and right where the ribs happen to meet. This camera is interesting. Where the ribs can't meet my hands. Where that ribs, xiphoid it's called, the bottom of the sternum, you can actually touch that. It often is very, very tender, but it's a rheostat that will turn down the contraction in the muscle, and you just hold it and move it very gently for maybe 30, 40 seconds. Don't do it when you're in a car next to a school bus full of kids. So you can do that, then you can actually switch hands and use the other side. The same thing happens in the middle of the temporalis muscle, and that will be often very, very tender, especially if there's been some falls or if it's been serious, lots of TMJ. So 10, 15, 20 seconds on each of that side, and as well on the other side. And those areas are very, very helpful to reset the TMJ. Some people have found that, and you can consult with your medical practitioner, that B5 is very helpful. It's called pantothenic acid, and it works with very fast twitch muscles. The normal recommended dose is about 10 milligrams a day. However, if you check with your provider, some people will take up to 250 milligrams. And what that does, you don't take it late on in the day because you may not sleep that well later on. But what it does, it tends to allow these twitch muscles to stop going into a spasm as much. When we look at emotion, we've got lots of emotions these days, and fear is the big one. And that makes us doubt that we know where we're at and where we're going, how we're going to get there. But we often bite down, we often sink down, we often have sorrow and a lot of disappointment as well. We look at the anger that says, I don't have control here and I've got to do something, I've got to punch something, but generally we keep our mouth closed and we bite down. The fatigue is another thing. Many people with TMJ will actually have pain at nighttime with their sleeping. They'll often have irregular times when they wake up at night. The large intestine pathway is, for farmers, is from 5 o'clock until 7 in the morning. So often their digestive system will be off, so they don't have a bowel movement at that time. What we can do is look at how we get out of a situation. And what I can do is tell you, I'm going to give you an example. This is, I'm holding my fists here, and be quick to listen. And most of us are not quick to listen. We're quick, and I want you to be very slow to speak. So get the information in and just hold your tongue. Okay, that's sometimes a vicious thing. Just hold your tongue and sort of say, do I really need to take the bait and respond in this? And so some of the things for us is that we look for faith, and we come to a belief system that, oh, there's something else that can be done. There are some trigger points that can be managed. There's a posture change that you can. The head is supposed to, if this is the neck, the head is supposed to be right on top. It's not, but the neck is not supposed to be way over here straining the muscles, because when the muscles in the back of the neck are strained, then you bite down in order to recruit the strength for those muscles. We're all looking for hope. We have a belief that we're going to get through various things that are happening. We look at trust, and we can trust our therapist to communicate with other therapists in order to find out what might be missing. Is there an x-ray that's needed? Is there an MRI that's needed? Sadly, we lose the courage to continue on looking for the answers when we're told over and over again, well, I can't find anything. The tests are all normal. Sometimes a neurologist will say, no, I don't think the jaw will be giving you any pain down into your arm, but it actually can do that, and using those trigger points. Often we say we get chronic indigestion problems because of the emotion, the way we perceive what's going on in life. And we go to the gastroenterologist, and we have a biopsy here and an x-ray up and an x-ray down, and we're given the diagnosis that says, well, sorry, you've got this, but they often miss the fact that they'll get shoulder pain based on what's going on with small intestine. But generally it's medication, and I guess you've got irritable bowel, and you can be irritated about that, but there's nothing more that I can do. There's lots that can be done. So my approach for you folks is to say, some of you are massage therapists or nurse practitioners or doctors or acupuncturists or chiropractors or osteopaths. Hopefully there's a way for you as a paying customer or someone who's investing time and effort to relieve your pain, to get your energy back, to get your life inspiration back. Hopefully you can talk with your practitioners and say, can you tell me where we're at? Can you tell me where you're going? Is there somebody else that can add something else in here? Is there a team of people that that can work on my particular problem? And sometimes the therapist will say, I don't think so. I think you're just stuck with it. No, that's silly. What we'd like to do is look at the communication system that the body has. So when we look at the acupuncture system, there's communication with the 12 acupuncture pathways, and there should be communication with the practitioners. There should be collaboration as well. Certainly diet will often, diet or environmental stress or perfumes will make people bite down. They'll make people cry. If we've got the wrong kind of water or we don't have enough water, that will make our system not work very well. The other things that we're looking at in the future is to look at epigenetics. And epigenetics is the study of what turns the genes on or off. As well, we can take a look in the near future at the microbiome, because there's lots of work done on that in the last 10 years' time. The pharmaceutical companies are now getting into it, but there are certain organisms in the upper gut and certain organisms in the lower gut that help us to help with our digestion. When we relate that to the TMJ, a lot of older people or even some of the young people haven't got very good biting down mechanisms, so they can't chew their food. Often they make it up in a drink and they swallow the drink and forget to tell the brain that this stuff is coming. That's what the taste buds are for. So if you're making a nice smoothie, take a mouthful of the smoothie, taste it, move it around in your mouth. Just don't wolf it down like it's like a soda. Because our taste buds allow us to find sweet and sour and bitter and pungent and salty. And we have to have an idea of that. And the brain gets that message from the mouth upstairs. The fascination is to see many people who've been stuck for years and years and years. They forget they had a car accident. They forget that they had a fall. They know they're in a pressure cooker of a job, or their family is not supportive in some way, and their shoulders are almost up to their ears, and they've got pain in between the shoulder blades as well. They can't take a deep breath because when these muscles are in spasm, we put the diaphragm in spasm as well. The diaphragm actually um, is about 15,000 times at 24 hours that it has to move up and down. So you have to feed the diaphragm properly. We also have to feed the heart properly because there's about 100,000 beats per day per 24 hours. So three things that I can make some sense of for you is magnesium is a relaxant. Calcium is a puts into something into spasm. We need magnesium much more. There's a book written by Carolyn Dean, who's a Canadian MD who's emigrated to the United States. She's now also a naturopath. She's written a book called The Miracle of Magnesium. The second edition, I think, is The Magnesium Miracle. But she's now come up with the studies, and so documented in her book, that says instead of 10 calcium for one magnesium, look at the information, and what she's saying is that perhaps you take one magnesium for one calcium. We need the magnesium to run our Krebs cycle, which is our energy producing cycle. We need it for the heart that does as much work. We need it for every muscle as well. So those are some of the thoughts that I have. Do you have some areas that I might like to speak to?
Actually, you know what? I had questions prepared, but you answered every single one of them in that 28-minute talk. So, but that comes from us working together for so many years. So we think alike. So I'm hoping you can hear me from way over here. But I just want to say, please show the love for Dr. Tom. Please put some comments in. If you enjoyed this presentation, please let us know. And if you have some topics that you think you would like to hear about, if you need help with anything, Dr. Tom wants to help as many people as possible. And he is willing to come back and do some of our live at fives on Tuesday. So let us know what you need and we'll be there for you. So.
And this is a book. It's called Myofascial Pain and Dysfunction, the Trigger Point Manual. And it's Janet Travell, who passed away at age 94, but she treated John F. Kennedy and looked after his pain. The book is quite valuable. It's about $160 for the first half upper part of the body. It's $160 for the other part. It's so good that, in fact, one of my patients walked off with the book. I'm glad to point out some things that it's not just about migraine. It's just not about frozen shoulder. If we go and you look at the muscle that's inside, oh, here's somebody left their shoulder here. This is the wing bone and the scapula. There's a muscle underneath there, and that muscle often goes into spasm and it gives you a frozen shoulder. It's called the subscapularis. So you might talk with the massage therapist about that. The other aspect of pain that we have in the neck is that the disc will put pressure. Sometimes where the vertebrae fit together, it's like, let's see if we can get it over here. Where the vertebrae fit together, there's a little joint called a facet joint, and sometimes it will get some wear and tear, and it puts pressure on the nerve as it goes by. So, there we go. So the disc is often very much flattened, and it's very much pressured against the spinal cord as it goes along. So facet joint problems in the neck are really common. Please don't look up when you're on a ladder because you'll fall off the ladder if you got a lot of facet stuff, because it triggers the muscles to go weaker than what they should. Okay, that's where I am. So I'm so thankful that you can listen, and we do a lot of work within the practice for people. We teach them how to walk. We teach them how to lie down. We teach them how to sit up. We teach them how to stand. And you'll be surprised. that the pregnant ladies know a lot of stuff that we don't. What they do is when they stand in a grocery store, they move their weight from one side to another because they don't want to fatigue the muscles. And they also put one foot in front of the other. And they don't put their feet together so that the wind will blow them over. They got to stabilize themselves. So have a good evening. Thanks very much for tuning in. See you again.
Take care, everybody. We'll see you next week, next Tuesday at 5. Don't forget to tune in, put it in your calendars. Bye for now.